Hello everyone, this is Dr. David May from May Vision Center. I hope everyone is staying happy, safe, and healthy. I just wanted to go over a few things as far as what we're doing here at May Vision Center amidst the corona pandemic. As you know, things really ramped into full force here at the end of February, early March, and we voluntarily closed the office on March 20th. We have not been seeing anything but emergency patients up until now, and I have elected to start seeing exams and all of our typical care here at May Vision Center effective May 4th. So I wanted to explain a few things as far as what we're doing from a protocol standpoint to keep you, our patients, safe and healthy. That's our number one priority. So first of all, what we're going to do is try to triage and get as much information as we can before you enter our facility. So over the phone, we want to make sure that we capture as much information. If you don't have a health history form filled out or any insurance information, we want to gather that before you actually enter the office. We do have some forms online, so if you're a new patient to the office, we want to make sure that you go to our website, download the health history form or print it out, have it all filled out so that when you get here, that's one less step that we have to have. We want to limit the amount of time that you're standing here at the front desk and that the amount of time that you come into contact potentially with anybody else here in our office, especially other patients. So when you do arrive for your appointment, we do have a sign outside that indicates for you to please call the office when you arrive. When we pick up the phone and answer that phone call, we will ask you a few questions, see if you have any type of COVID-19 symptoms. We want to triage that. If we feel that it's not in the best interest, depending on the remarks that you have, we'll reschedule that appointment. So we are triaging all of our patients to make sure that they don't have the potential for the COVID-19 virus. After we get started and let you know when it's time to come in for your appointment, one of my technicians will indicate or call you and greet you at the door. All patients, all staff are required to have face masks on. We are asking that you bring your own face mask because those are in very limited supply. If you do not have one, one will be provided for you at a minimal charge. After that, if you do have glasses, we are going to walk you over to our optic wash system. This is a machine that will actually kill 99.9% of bacteria and viruses. So what we do is we'll have the patient, you, come over here. Our staff will hit the button. This will open. You actually take your frames, put them in here, and start. We start this. There's actually a little sprayer in here. It'll actually spray and dry the glasses. Once that's done, or as that is being done, my staff will actually grab the Surface Prep, which is a disinfectant that we'll use to actually spray your hands. And we'll have you actually rub your hands until that dries off. A couple things we'll get away from that because it's a little bit noisy. A couple things about that. First of all, the optic wash is a device that, like I indicated, actually kills the bacteria and the viruses. That is something that's not done with chemicals. It's actually done with UV light. So UVC light is actually what kills the virus. Okay? So that's one of the precautions that we're taking here in the office. And it's not. This is not just something that we're doing specifically for the virus. We've had this unit in our office now for almost a year, and our customers and our patients really like that aspect. So you can come in any time and get your glasses cleaned by swiping a card through our machine. So my staff would be happy to answer any questions in regards to that. As far as the surface prep that we're using, this is something that I've been using in my office now for probably 6 to 8 months. It's a phenomenal product. It has what they call hypochlorous acid in it. It's not hydrochlorous acid. It's very gentle. It actually is better than hand sanitizer. Because of the components in that, it is 80 times more effective at killing bacteria and viruses than bleach. So it's very gentle and very potent. So it will kill anything it comes into contact with. This is what we're using to wipe down all surfaces in our office, countertops, any high-touch areas, door handles, any bathroom, and we'll get to the exam rooms and etc. And I'll kind of go over as far as what we're doing in that aspect as well. If you do have to be here at the front desk after checkout time, which most people do, we have a couple other protocols here. So if anyone actually touches a pen, signing a document, etc., that pen will actually be put into this bucket, and we will disinfect those pens at the end of the day, so they are not being used by other patients. We do have certain distancing requirements here in the office, here at the front desk, so that you keep a far enough distance away from our staff, especially my receptionist here, especially at the front desk. So we'll have markings on the floor, and we'll just let you know as far as what that comfortable distance is if you do approach the desk a little bit too closely. If you need to run a credit card, we are requesting that you handle the credit card. I do not want my staff actually taking the credit card from you. So you can actually, the credit card swipe is right here on the front desk. So you can probably take one step forward, swipe your card, and just stand an appropriate distance, approximately 6 feet from my front desk receptionist. So let's kind of work our way back toward the exam room so that I can kind of show you what we're doing in that regard as well. So one of the other things, for those that have been here, we do have kind of a dispensary area where we used to have a coffee maker, we had some magazines, any high-touch materials that we had in the office, we actually eliminated. So magazines, coffee maker, toys, etc. So we're trying to limit anything that potentially that you could come into contact with to spread this virus. So let's go back to the testing room. Some of you probably recognize some of this as far as the equipment that we have in here. So I'll have Morgan come over here for a second and I'll have you show you the Optimap and the OCT. So those two instruments that she just zoomed in on are two instruments that we're going to be doing on every patient. Due to the information that's able to give me as far as your overall health, we're also trying to eliminate the extended time that sometimes dilation can affect, additional 20 minutes potentially if a patient's dilated. It's actually giving me better information. A lot of my lenses and stuff are fogging up in the exam room because of the mask that patients and myself are wearing. Due to the better health care that we're able to provide with these instruments, this is something that we are doing for all of our patients. And if you have any questions on any of that, I'm happy to answer any of those, as well as my technician or anybody else here in the office. So let's go to the exam room. So one of the things that we've done is we've got these signs. So when the patient comes up to the exam room, these exam rooms should be cleaned before they even get there. So we will have a sign if after a patient leaves, if that room has not been cleaned, we'll see this. And my staff knows that they will not be allowed to enter that room. Once it's cleaned and disinfected, then we'll flip the sign, then the patient's able to go in. So we will be wiping down all of the touch areas here in our office, in my exam room. The countertops, we're going to be wiping down anything the patient comes into contact with, as far as any type of paddles, armchairs, or the chairs itself, microscope. I've actually got a shield here on my microscope so that I don't breathe directly on my patients. Once the patient leaves the exam room, like I said, this will actually be flipped over. We'll put that on, and no one's allowed to be in the exam room until that's cleaned. For my contact lens wearers, for anyone that wears contacts that needs to take their contact lenses out, we'll have you come over to the sink. We'll have you wash your hands, take the lenses out. You will use a little bottle of solution. Once this bottle is opened by the patient, this bottle goes home with the patient. We are not reusing any bottles for any other patients. So this is yours to keep. That's another precaution that we are doing from a contact lens standpoint. Now, I do want to reiterate something too that I've been talking to a lot of patients about, because we've gotten a lot of questions. Is it safe to wear contact lenses during the COVID-19 crisis? Yes, it is. Making sure that you practice good protocol, okay? Washing your hands before you either insert your contacts or you take them out. Daily disposables are still the best, healthiest route for patients to go. Not everyone is a candidate for daily disposables, but if you'd like to be in a healthier lens and you haven't tried daily disposables, please talk to us and we'd be happy to go over that option with you. Let's go down into the optical. So once the patient is done here, they are walked out here to the optical. If you need to look at glasses or you want to try some on. So what we're doing here in that aspect, a lot of people are concerned that they want to just wear or try their glasses on possibly online or order their glasses online, because they don't want the aspect of being close to somebody or to touch something that somebody else has touched or put on their face. So the new protocol that we have in our office is for any frame that a patient either touches or tries on will actually be put in a tray, and once that patient is done with trying on glasses, we will actually disinfect every one of these frames before they're put on the board. Okay, so I just want my patients and our customers to understand that everything that we have here as far as these frames have been disinfected before they actually try them on. Okay, so don't be afraid that someone else touched that and you could potentially get a virus. Okay, we've eliminated that here in the office. After that's done, I mean, one of the other things too that we certainly are doing is practicing the social distancing here in our office. So if we have an inappropriate amount of people here in the optical, we will limit that to the best of our ability. If somebody walks in and we feel that we have appropriate number in the office and that kind of puts us over the edge, we will actually contact and just talk to that patient and say, if you could please, we want you to go out in your vehicle and wait. We'll let you know when it's appropriate to come in when we don't have as many people in the office. So we are practicing the social distancing. We're trying to limit the amount of people here in the office. So those are just a few of the things that we're doing here in the office. A couple other items that I just want to kind of throw out there for everyone. We have not had any patients or any staff that have been tested positive for COVID-19. So we've never had any of that over those viruses that we're aware of that have come through the office. Like I said, I've seen only a very limited amount of emergency patients, so we haven't had too many patients in here in the last 5 or 6 weeks. I also want to just stress the aspect of keeping our community strong and supporting your local businesses. There's a lot of businesses that are really, really struggling right now, and we want to make sure that we support each and every one of those the best that we can. If there's something that you can get locally, please do that. I know it's easy to order things online and have it delivered to your doorstep, but a lot of these businesses depend on you for that support to survive. So if you have any questions about what we're doing here in the office, please give us a call. We can email, you can text us, and we'd be happy to answer any of those questions. So we look forward to seeing you again soon, and take care, be safe, and we'll see you soon. Thank you.